Simon, Paul and Beth are all studying for the Adult Nursing Diploma in Higher Education at the University of Central England. The Faculty of Health at UCE has developed an innovative multimedia online patient assessment simulation called the Virtual Ward. This visual representation of a clinical environment asks students to find the information, critically examine it and relate it to their existing knowledge. Ultimately, it is hoped that the virtual ward will enhance students' problem-solving skills and their ability to apply theory to practice.
I really appreciate the interactive nature of the virtual ward because I don't think I'm a particularly academic person. So, you know, when you're participating in it, you just remember it a lot more, really.
When you're just sitting in lectures and you're just writing notes, you're learning some of the theory, but I know that you forget a lot of it when you're there. At least with the virtual ward, you're able to put a lot of the stuff into practice straight away. You can look at certain things and assess the patient as they're there without any worries about being on the ward and having all these other things around you.
I can sort of see that this approach is trying to emulate reality. It's not just a series of hoops that they've got to go through in order to pass their exam. So I see it as a very good introduction.
I found it quite a fun thing to take part in, and that sense of kind of fun and something new encourages you to chat to other people about it.
When we was going for the virtual ward today, one of the girls I was talking to, her friend was on the other side of the classroom and they were discussing one of the problems through an instant messenger.
I think overall it'll be a great resource. It'll stop me sort of looking at a book and falling asleep.
Although Simon, Beth and Paul all appreciate that working on a real ward will be a great deal more frenetic than a virtual one, they all feel that this online environment is helping them to consider in more detail how to assess patients.
On an average ward, I would say that there's about 25, maybe 30 patients. But this technology is helpful because already of being focused, you know that you've got those patients right from the outset.
In normal life, patients would have lots more problems probably that you'd have to deal with, but it's really helpful to have the freedom and the time just to focus on those problems and really think in detail about how you would actually assess that patient and care for them and not feel pressured like you would on a ward.
I think a lot of student nurses, when they go into wards, they're too afraid to look at things or try things, or they're concentrating at one thing at a time. Well, at least with this, you'll be able to look at the whole picture and maybe look at certain equipment that probably you wouldn't have a chance to have a look at before. If you got something wrong, you can go back, you can try again, and you're able to make mistakes and learn by them straight away.
The virtual ward offers student nurses a different way of learning, and the fact that it is online means it can be used at home as well as at university. These learners are comfortable with learning through technology and are aware that they will be expected to use technology fairly heavily in their future careers.
Technology appears so seamlessly and so subtly throughout my life. You almost take it for granted, really.
The future of nursing is heavily dependent on IT.
These days, you have to use it constantly on the wards. Surely this is only a better way to be more comfortable with computers.
I've been pleased with the way that they have facilitated our learning through using technology, and I think it's something that's really helped me with my studies.